My name is Eliza, and I am sitting in a hotel in Straubing, Germany, after having just had disc replacement surgery. How many days ago now? What day is it today? 5 days ago. So I'm 5 days post-op, sitting up. My surgery was artificial disc replacement from L3 to S1. So I had those 3 discs replaced with ProDisc-L, so lumbar artificial discs. So I had, intermittent low back pain episodes on and off since college, since I was 19. In the year 2000-ish, they started getting more frequent and more severe until finally in 2003, I had a back pain episode that started and just never went away. Instead, it got worse and worse and worse. And then I ruptured 2 discs and I had surgery number 1. A few years later, ruptured another disc, had surgery number 2. And that was less than a year ago, actually. So I've now had disc replacement surgery with the hope that this will stop the degeneration that's been going kind of in domino effect up my spine. So that's sort of the historical snapshot. The way that I came to be here is that from the very first disc rupture experience, I started doing a lot of research on my condition and what the different treatment options were. Because after my first surgery, my back pain continued. And I didn't really understand until after that surgery that it wasn't meant to address my back pain. It was only meant to address the nerve issues that the ruptures had created in my left leg and spine. And so I went online and spent a lot of time reading as much as I could on the subject, and I learned about artificial disc replacement that way. And when my back pain continued after my first surgery, I made my way to a neurologist who actually recommended artificial disc replacement, and he wanted to actually perform the surgery on me. And when I asked how many of disc replacement surgeries he had performed, the answer was 0. And so I decided to seek a second opinion and find a doctor with more experience. Through doing that research, my surgeon in San Francisco, where I live, actually recommended Dr. Bertagnoli. And of course I had come across his name already in the online research that I'd been doing, and quickly, established that he was the guy to go to, particularly for ProDisc implants, which I believed, based on my reading, were the best discs for my particular case. And so that's how I found him. So I'm 5 days post-op, and this morning I sat at the breakfast table and ate a bowl of cereal with my family. And, to anyone who's been in my shoes, that's huge. And the idea of being able to do that 5 days after this surgery is astonishing in my mind. I certainly didn't expect it. I sort of read stories about other people having that experience and thought, there's no way that that would be me. And it is me, and that just totally blows me away. So I can get up and do whatever I want. I can walk probably, I think we were outside today on our morning walk for a good 10-15 minutes maybe, and I was tired, but I wasn't in agony, and I didn't need to lie down the second I got back to the room. And I'll get up and do that again, 3, 4, or 5 more times today probably. The trip from Bogen, we moved from Bogen, where the hospital was, to Straubing, where we are now, the day that I got out of the hospital, which was yesterday. And the car ride was a little tough. It's not a long ride, but just being in anything close to a sitting position is still very painful for me. And the pain kind of snuck up on me, and I didn't feel it right away. So last night I was in some pain, and I had to take some of my regular pain breakthrough medication, which I haven't had to take since I've been here, which amazes me. So yeah, my general energy level is higher than it's been in a long time, and my pain level is much lower than it's been in a long time.
What do you hope for out of this? What do you hope? What kind of looking forward now into the future? What do you see? What do you hope for? What will this surgery have enabled?
From the very beginning of this process of deciding to pursue this surgery and deciding to come to Germany and deciding to work with GPN and Mark and, just kind of thinking about the whole thing, I've been very mindful of managing my own expectations so that if I were to have a difficult time, that would be okay, that it wouldn't blow apart and destroy some, idealized fantasy. So I've been very careful to make sure that my expectations were realistic. And, going into the surgery, my criteria for success was any reduction in pain. Any, 1%, 2%, not 50%, not 80%, any. After living in this state of pain for almost 4 years solid, being in pain management, having to stand all day at work, and just the ongoing agony. Having any part of that go away would make this worth it. My secret internal fantasy that of course I can't help but have is that this will enable me to return to sports in some way, in any way. I've always been active and an athlete and a snowboarder and surfer and marathoner, and losing those things has been probably the most difficult part of this for me. I still can't talk about it without getting choked up. So I tried not to let myself really hope for that stuff, so that in case it didn't happen, I wouldn't be too bummed out about it. But the truth is, I think it probably will. I think it will. 5 days after surgery, I think it will. And, that's just a beautiful thing. It's not about being in control of your body. It's about enjoying your body. It's about enjoying your physical self and, just all the things that just come from being active and being outdoors. And, the hardest thing about this is losing that and, not being able to walk your own dog, or not being able to, go skiing with your friends, or, not being able to go to a movie, or, go on an easy hike, or surf a little itty bitty wave, or snowboard a bunny hill even, it's not about losing. It's not even the social part, it's not the social part, it's not the physical wahoo, thing. It's about being comfortable in your own skin, rather than being betrayed by your body and really feeling, let down and so disappointed. So that's the thing that I hope that this gives that back to me.